Hey, you guys, happy Wednesday. Welcome back for another week of Work It Out Wednesday. On Wednesdays, we work out a practice questions on the topics that we're covering for the week. This week, we have been covering the second week of our non clinical series to include cultural topics, ethics, and legal issues. So let's get into the questions. Question one states, what ethical term is defined as the act of being truthful? Is it A, non maleficence, B, veracity, C, justice, or D, accountability? Tell me what you think in the comments. All right, so this whole question is the stem. So, what ethical term is defined as the act of being truthful? So, with these, you just kind of straightforward know the terms and the definitions, right? So, A, non maleficence is to do no harm. So, we know that's not the answer. B, veracity means truthfulness, right? So, that is the answer here. B, veracity. Think truth when you think of veracity. C, justice is to be fair, fairness. D, accountability is taking responsibility for one's actions. All right, let's get into our next question. Question number two states, a 30-year-old Asian female presents to the office with complaints of fatigue, lack of energy, and tiredness. She states that she works full time, is in school, and is married with two children. Her husband mentions snoring and that she appears to stop breathing while sleeping. When the nurse practitioner discusses a referral for a sleep study, the patient refuses. She states that she will schedule an appointment for acupuncture. What is the best action? Is it A, explain to the patient the importance of a sleep study? B, tell the patient that acupuncture will not aid in her lack of energy? C, support the patient's decision while advising her on the benefits of a sleep study as well? Or D, tell the patient that if she can't follow your recommendations, it may be best to find another provider. All right, you guys, take a moment, read through the question, and tell me what you think in the comments. All right, all right. So the stem of the question, I always tell y'all to read that first to ensure that you're answering what they're truly asking you. So it's asking for the best action. So what is that best action to take now? So the scenario is explaining a patient who has fatigue, she's tired, she has no energy. Husband is mentioning that she's snoring, that she appears to, have some apnea, right? She's not stopping breathing while sleeping, and the nurse practitioner has advised for a sleep study, but the patient doesn't want to. She wants to have acupuncture. So, would you explain to the patient the importance of sleep study? Yeah, that is something you should do, but we'll hold that. Tell the patient that acupuncture will not aid in her lack of energy. No, when we're thinking about cultural beliefs and practices, our cultural awareness of what different cultures do and believe in allows us to competently care for them and manage according to their beliefs and their values, right? So we wouldn't do B. We wouldn't tell them that this will not aid them in something. C, support the patient's decision while advising her on the benefits of a sleep study as well. Yes, that is the best of both. You, as the provider, the practitioner, you're letting them know of the benefit of what you have recommended, but you're supporting their decision and beliefs for what they should do for themselves. That is always the best answer. And then D, of course, you ain't telling nobody that, hey, listen, you ain't listening to me, so go. Like, no, that's completely inappropriate, right? All right, you guys, just wanted to give you two quick questions to kind of gauge that so you can wrap your mind around how the cultural topics may be presented and how those ethical terms may be presented and to test and gauge where you are. If you are struggling with any of these, go back and check out the video from yesterday where I went through all these terms and to discuss these areas. And then tomorrow, that we will have a video that goes through the repetition and studying because that's what we're doing for this series because repetition is key, right? So we'll do a study round on Thursday. All right, as always, you guys, like, comment, subscribe, and share with whomever you may think may find this helpful. But be sure to meet me back here next Wednesday for more Work It Out Wednesday's practice questions. Bye, y'all.